Hello and good evening, everyone. I, Ayushi Sahegal, and my co-host Achyut take the pleasure of welcoming you all to I Can Survive, a breast cancer awareness program presented to you by SerWings and the Vox Populi Club. We'd like to extend a special welcome to our very supportive and encouraging club mentors, Ms. Disha George and Ms. Arpita Sen Gupta.
The office bearers of SerWings, President Arshad Khan, Vice President N. Sweta, Secretary Abir Ayraj, and Student Coordinator Pravalika Sambara. Vox Populi President G.S. Gayatri, Vice President S. Kartikeya, my fellow Marians and participants.
Delighted to have you all to participate in this awareness program, and we hope that today's discussion makes this topic a little less intimidating.
SerWings and Vox Populi have collaborated to put forward this program as an effort to raise awareness and reduce the stigma of breast cancer through education on its symptoms and treatment.
2020 has been a powerful reminder that we are all in this together and that our choices and actions have the power to protect the most vulnerable among us in a big way. The same holds true when it comes to breast cancer.
Breast cancer is by far the most common cancer in women worldwide, both in developed and developing countries. There are about 1.38 million new cases, and currently there are not sufficient knowledge on the causes of breast cancer. Therefore, early detection of the disease remains the best treatment in controlling breast cancer.
And with this program, we join in the cause to help women in need today. Now, for our speaker, we have the president of Vox Populi, G.S. Gayatri, who will be talking about why it is important for us to have this awareness program.
Good evening, everyone. And first, I would like to introduce what is this event about and also give an introduction about what our clubs do. So, we are a club who helps students to get over their stage fear. Public speaking, quizzing, and debating are the integral aspects of this club. Students are taught how to research topics, articulate arguments, and exposit ideas. We also conduct various workshops and interactive sessions on social media platforms such as Instagram and YouTube on ways to overcome stage fear, organizing your ideas, and many other confidence boosting tips and tricks. It isn't without reason that Vox Populi is among the most articulate on campus, and we also teach our members to speak their heart without fear. Servings, in my opinion, is one of the best initiatives which took ground in St. Mary's College. Servings is a club that imbibes social responsibility among the students and reach out to the underprivileged. Members of the club help raise awareness among the students about social issues. The club strives to work towards including the marginalized in social and economic life of the society. It also helps its members to find joy in sharing and in bringing happiness to the less privileged. Servings builds leadership with character, and its members strive to be model citizens. Anyone who cares to make a difference in this world to their well-being, to their fellow citizens, and is interested in bringing about change in the society are welcome to be a part of this club. So today, we have gathered to raise awareness about an issue which is hardly discussed. October is widely known as the Breast Cancer Awareness Month. We are still hesitant to use the word breast, which silences the conversation about breast cancer. This is one of the reasons why many women do not know about the symptoms. When detected at a later stage, the chance of survival is very low. As the president of the club who believes in speaking without any fear, I expect that by the end of today's event, we destigmatize the issues around breast cancer and normalize this conversation. I would also like the listeners today to pass on the information you will learn today with your mother, sister, and friends who are women. God forbid, if this horrible condition ever happens to them, they can take necessary action beforehand. Did you know breast cancer is one of the most curable cancers today if detected early? So why don't we make this conversation a little more vocal? Without further ado, let us listen to our friends who are here to share some very important information with us. Thank you.
Thank you for that insightful introduction, Gayatri. The diagnosis of breast cancer is one of the most frightening experiences a woman can have. The discovery of a lump or changes to the skin around the breast can make them fear the worst. Many misconceptions exist about breast cancer, and there is something of a community taboo surrounding this disease. Bringing this discussion out of the dark is essential to demystifying cancer.
To do so, we have with us the Vice President of Vox Populi, S. Kartikeya. Over to you, Kartikeya.
Hello everyone. It is a matter of great joy to me that our two clubs, SerWings and Vox Populi, chose to collaborate and spread awareness on an issue that is very pertinent yet hush-hushed over, which is breast cancer. Breast cancer accounts for 14% of the cancers found in Indian women. Every year, over 1,62,000 women are diagnosed with breast cancer and 87,000 women succumb to it. One in 28 Indian women is likely to develop breast cancer. In urban cities like Chennai, Mumbai, Kolkata, and Ahmedabad, breast cancer accounts for 25 to 32% of all female cancers. It is most common among younger women, with 50% of the cases being found in the age group of 20 to 50 years. And more than 70% of these cases were present in an advanced stage, which makes the chances of survival pretty slim. These numbers are staggering and only rising. Breast cancer has overtaken cervical cancer as the most common cancer found in Indian women, and it seems like India is looking at a possible breast cancer epidemic. This then begs the question, why are more people talking about it? The reason for this is simple. It is a lack of awareness about this disease and its symptoms. An early detection of the symptoms, that is, the lumps, makes it easy for the cancer to be curtailed. However, there is a deeper reason behind this lack of awareness. It is the taboo that surrounds Indian women, their bodies, and issues. We are a highly conservative and patriarchal society that tends to simply brush in women's issues under the carpet. Moreover, we are also under the belief that women's health and their issues are not important enough. So that makes us take such dangerous diseases for granted. This regressive attitude makes it difficult to promote a better understanding of the disease. A lot of people are even unaware that October is observed as Breast Cancer Awareness Month. Hence, we expect all participants to be open, sensitive, and forthcoming about this issue. We aim to break the taboo attached with breast cancer so that it becomes easier to educate ourselves and others. With small yet definite steps, we can overcome this hurdle together. With the kind of impact that we are creating right now, I am certain that this is one of the most important events to be ever conducted in St. Mary's College. Thank you, and over to the first speakers.
Thank you, Kartikeya. I think it was about time we had that reality check.
It is now time to begin our discussion. And for that, we have Ibtisam Aisha, who will be talking about the most prominent symbol of breast cancer, the pink ribbon, and the causes of breast cancer.
Hello everyone, I am Ibtisam Aisha and I'm from BT2. I hope everyone has heard of dark matter in one context or the other. While there are theories and hypotheses trying to explain it, we don't really have a clue about it. They remain theories. Just like that, the development and growth of breast cancer appears in the same boat, at least for now. The whys and the wherefores of breast cancer development are unknown and under-researched. But what we do know is that breast cancer is a disease caused by rapid and accelerated cell division. These cells divide rapidly compared to normal cells and accumulate and form clusters, or as we like to call it, lumps and mass. Now, there are two routes these lumps can take. One, they remain where they are, that is in the breast, and form what is called a benign tumor, which are not necessarily cancerous, but they can be. Or the second way is that they travel via the lymph nodes and the lymph vessels and cause what is called a malignant tumor that can spread throughout the body. It is also known as the metastatic breast cancer. As aforementioned, the particular science behind breast cancer development and growth is inconclusive, but there are identified risk factors. It is argued that breast cancer is a cause of three things: genetic, hormonal, and environmental factors. Experts believe that 5 to 10% of breast cancer is a cause of genetic mutation which can be inherited. That means there are specific genes that cater towards an increased risk of breast cancer. The most researched and studied ones are two of them. BRCA1 gene, which is the breast cancer 1 gene, or BRCA2 gene, the breast cancer 2 gene. The one thing we can conclude here is that there is an abundance in scarcity of documented research and studies. We are not only here to raise awareness, but to enforce proper and reliable studies and research in this arena, which can help us uncover the cause and effect relation of this modern epic. That is what the ribbon represents. And if you're wondering why the ribbon, well, ribbon has been a part of our history for longer than we think, appearing in century-old poems, stories, and folklore. The first documented, however, was a yellow one. It was in support of an American army, a silent support. The well-celebrated ribbon in awareness of HIV and AIDS, and our beloved pink ribbon, the sole representation of breast cancer awareness. The pink ribbon, the beacon of hope, the semiotic landmark of breast cancer advocacy, right? Unfortunately, she begs to differ. Allow me to introduce you to a woman called Charlotte Haley, and I implore each and every one of you to remember this name. Haley wasn't just a breast cancer survivor herself, but a mother of one too. She had seen enough hardship and pain in her life. She persevered. You see, she was an activist at her core and a passionate one at that. She wanted to change. She wanted to start a movement. So she did, right from her living room. She sat at a dining table and made these very ribbons we see today. The only difference, they were peach, not pink. With every 5 ribbons, she attached a note that read, quote, "The Cancer's National Institute's annual budget is $1.8 billion US, and only 5% goes to cancer prevention. Help us wake up our legislators in America by wearing this ribbon." The very peculiar thing about Haley was how strictly grassroots her activism was. She gave out these ribbons to everyone she saw, from the grocery store to the church. She wrote to prominent women of the world, like the First Lady of America, Barbara Bush, in 1990. Her message was spread through the word of mouth alone, and it reached thousands. Ultimately, it reached the eye of one Alexandra Penny, the chief editor of Self magazine, who coincidentally was working on the annual issue of National Breast Cancer Awareness Month. As business goes, Miss Alexandra Penn reached out to Haley in hopes for collaboration, an offer that Haley declined. She feared that the commercialization of this ribbon will dwindle the effect of the message it carried. It was a message that held, not the ribbon. Well, with those efforts, there was a new alliance formed, one between Estee Lauder Cosmetics and Alexandra Penny. Lee said their ribbon couldn't be peach, so it went with pink, because what could be more feminine than pink in the 1990s? These new and rebranded pink ribbons were given at every Estee Lauder counter and promoted at every Cow Self magazine. Within a matter of months, the pink ribbon was sweeping the nation. The pink ribbon had the global hallmark of breast cancer advocacy. And about Haley's speech ribbons and their message? Well, they were forgotten, left in the dust of capitalism. Again, Haley persisted. Her activism and commitment never faltered. She fought for the very cause we are here for until her dying in 2014. The myth that Evelyn Lauder created the first ribbon is just that, a myth. So, the next time you see a ribbon, think of Haley, an advocate, an activist, a breast cancer survivor warrior. And the next time you think of breast cancer awareness, stop yourself for one brief moment and think peach. Thank you.
Thank you, Aisha. After listening to that story, I'm sure that we'll all think before we pink.
Regular examination of breast on your own can be an important way to find breast cancer early, when it's more likely to be treated successfully. For this, we have Abir and Shreyasi, who will be explaining us the procedure to a breast self-exam.
Good afternoon, everyone. So, breast cancer self-exam is a technique wherein an individual examines his or her breast for any physical changes or any visual changes. This is actually used as an early detection method for this cancer. Here, both men and women should at least do this once a month as they turn 18. For women, the best time to do this exam is 4 to 5 days after their periods. But if they have gone under menopause, then they have to do it on that specific date. But if they are pregnant or have irregular periods, then they have to choose a specific day of the month and perform it each month. This exam should not be performed with any lotion on their fingers or on their skin. Even if you find a lump, there is no reason to panic because 80% of them are non-cancerous. Now, Now my friend Shreyasi here will be talking about the signs and symptoms and how you will be self-assessing this cancer.
Knowing how your breast normally looks like and feels is an important part of breast health. The most commonly known symptom is the lumps, though these turn out to be benign. And then there is these differing sizes and shapes of breast, where at times veins become more visible, that is called breast swelling. Sometimes there's large amount of milk and blood discharge, nipple discharge without pregnancy. Talking about nipple changes, it includes retraction, development of sores, itches, and burns. Without treatment, this can spread to other parts of the body, causing headaches, nausea, muscle weakness, etc. So, how do you self assess yourself? Begin by looking at your breasts in the mirror. Raise your arm and look for any changes in size and shape. Look for any signs of fluid coming out of one or both the nipples. Next, feel your breast while lying down. Use your right hand to feel your left breast and then your left hand to feel your right breast. Use a firm, smooth touch with the first few finger pads of your hand, keeping the fingers flat and together. Step 4 being, in a circular motion, cover the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen and from your armpit to your cleavage. Cover the entire breast. Finally, feel your breasts while you're standing or sitting. Many women find that the easiest way to feel their breasts is when their skin is wet and slippery. So they like to do this step in the shower. Cover your entire breast using the same hand movements mentioned in step 4.
Now, even if you find these symptoms, then it is not necessary for it to lead to breast cancer. It can also be caused by various reasons, like the one mentioned before, which is irritation on the skin, which can be caused due to dryness or applying less moisturizer on that. Now, if you find these symptoms worsen over time, then it should be reported to your health professionals so that the cause can be found. Thank you.
Thank you, Abir and Shreyasi. That was very well put.
In the past 10 years, major achievements have been made in breast reconstruction following a mastectomy surgery. No longer do women need to face long, jagged scars that impact their self image. To help us understand this topic in detail, we have with us the third set of speakers, Jennifer and Shrujati.
Good evening, everyone. I, Srujati Rallapalli, and my partner Jennifer are here to deliberate upon the topic, role of plastic surgery in treating breast cancer. Breast cancer occurs when some breast cells begin to grow abnormally. As per the research, 7% of women are affected by breast cancer. These cells divide more rapidly than healthy cells do and continue to accumulate, forming lumps or mass. Surgical removal of these lumps is called mastectomy. Breast cancer often starts very small to be felt. As it grows, cells may spread through the lymph nodes to other parts of the body. This causes health issues and can even lead to death. If found in initial stages, breast cancer is certainly curable. And why does one think of plastic surgery after mastectomy? That's a crucial question. For obvious reasons and social norms stating that breasts define the structure of a female body better. Few women opt to go for reconstruction of breasts for this reason, and the importance of reconstruction will be taken by my partner Jennifer. Over to you, Jennifer.
Hello everybody, this is Jennifer. So, is it really important for someone to do a plastic surgery? Well, it is their own opinion, but it is suggested for someone to know. It is suggested for someone before a surgery for a time. So next comes methods of reconstruction. So here is reconstruction. Here is reconstruction. The first method, the first method, the method consists of two different surgeries in which they insert a balloon-like device between the skin and the chest wall. It is taken place under the first surgery, which will expand within a week. Later, on the second surgery, they remove the balloon-like device and place it on the final implant, which is made up of a flexible silicone in the outer layer and which is filled with saline. That is simply and saline water. Second method is autologous, a flap method, using tissues transplantation from the outer body cells such as belly, thigh, and back. This method is longer and more complex too. Since more the tissue are removed from the body, we will face few side effects. And these side effects are numbness in the region where the tissues are removed, and also raise in cause of infection and also a high flow of blood. Finally, what is the connection between the breast cancer and the plastic surgery? Well, the breast cancer and reconstruction surgery has got nothing to do with each other. And plastic surgery is certainly not a key element for the treatment process. Keeping in mind that we all are beautiful the way we are, the survivors started to go flat. Let the embarrass of ourselves remove and celebrate the inner beauty. Thank you.
Thank you for your valuable inputs, Jennifer and Shrujati.
Although it is rare, men can get breast cancer too. Many people do not realize that men have breast tissues and that can develop breast cancer. Arshad and Sudhanshu are here to talk about the various factors that are related to breast cancer in them. In men. In men. Thank you.
Good evening, everyone. This is Siddharth. Today, me and my partner Arshad will bring into light the topic, does men get breast cancer? Breast cancer is something which is seen in women because they have breasts. But no, although it is rare, men can also get breast cancer. Women and men both are born with breast cells and tissues. But in men, they are not active as they are in female bodies. What differs is women, because of their reproductive ability, develop milk producing breasts and not men. But still, the breast cells and tissues can develop cancer both in men and women. Almost 1% of the males constitute breast cancer patients. The common type of breast cancer in men are ductal carcinoma, which originates in the milk ducts, and invasive lobular carcinoma, which begins in milk-producing glands. But men have very few lobuli in the breast tissue, so it is very rarely seen in men. Cancer in men is a smaller amount common because male breast duct cells are less developed than a female's. This is often because men have lower levels of hormones that affect the expansion of these cells. So it is important for men to understand that carcinoma may be a possibility and to understand what to aim for should they notice changes in their breast. I'll further pass it on to Arshad so that he can enlighten us further ahead. Thank you.
So the common symptoms include a lump or swelling, skin dimpling, nipple retraction, redness, and discharge from the nipple. Many people don't know that men can get carcinoma because they don't consider men as having breast. Most men who get carcinoma are over 60, although younger men are often affected. The breast of an adult man are almost like breasts of a woman before puberty. In girls, this tissue grows and develops, but in men, it doesn't. But because it's still breast tissue, men can get carcinoma. Doctors thought to think that carcinoma in men was more severe than it had been in women. But now it seems that it's about an equivalent. The major problem in that carcinoma in men is usually diagnosed later than carcinoma in women. This might be because men are less likely to be suspicious of something strange there in area. So there is a stigma. Why do not they recognize the breast cancer? It is a misconception that men do not have breast, and the word boobs or breast is not associated with men but women. If a man has breast, then he is considered as a feminine. This gender bias plays major role in effective diagnosis of breast cancer in men. It becomes taboo if a man is diagnosed with a breast cancer, even in his family, graver than admitting himself to be a gay or having AIDS. This is the severity. This is the severity in our society, especially in our Asian culture. When it comes to recognizing, diagnosing, Western countries have normalized this, but they have showed interest in Indian medication, mostly in Ayurveda. So when it comes to Asian culture, one has proper medication, but we are lagging in destigmatization or neutralizing it. To find the cure of breast cancer, Western countries dwell to the Asian countries. So the dependence of Ayurveda speaks that of allopathy, but needless to say, one needs to strike an equilibrium between both the medical methods. So henceforth, we should look into this particular concern as a humane thing rather than a gender. Thank you.
Thank you for enlightening us, Arshad and Sudhanshu.
As breast cancer is usually associated with women, you may feel embarrassed talking about it at first, but talking is also a part of the healing process. So make sure that you reach out to someone for support. Next in line, we have Nabila, who will be bursting some myths about breast cancer for us.
Interpretations to acceptance doesn't take any long, and since cancer is such a sensitive topic, we are prone to avoid even discussing or talking about it, because of which we end up accepting whatever we hear, we know, leading to a jumbo pack filled with so-called myths. Considering lots of misconceptions about breast cancer, let's discuss about the few of these which are common among those thousands. Myth 1. I don't have a family history of breast cancer, and so I can never get it. Relatively comparing the patients those are diagnosed with breast cancer mostly have no family history, as only about 5 to 10% patients carry a positive family history and could be hereditary, for meaning caused by abnormal changes or mutations in certain genes carried from the parent to the child. When looking forward to the causes of cancer, they can probably be many things such as radiations, stress environment, obesity, etc. We can't often conclude the causes of breast cancer, but one main risk factor could be being a woman. And the next is the myth 2. I have a healthy weight. I exercise daily. I have a healthy diet plan and I don't consume alcohol. So I don't have to worry about breast cancer. Stating a fact about it, controlling these behaviors can surely help in reducing the risk factors of acquiring breast cancer, but they can't eliminate it completely. These can't guarantee that the person can never get the disease. We can work on managing the causes of it and control it, but it's still important to get regular screenings, perform breast self exams, pay attention to any unusual changes in your breast. It is also said there's a myth that it's your fault, but one needs to understand that it's not your fault. There is risk with everything in life, so just don't beat yourself up. Myth 3. Annual mammograms guarantee that breast cancer will be found early. Although mammography is the best early detection tool we have, but it doesn't always find breast cancer at an early stage. Mammography isn't foolproof and can return a false negative result, meaning that the images come out and appear normal, even though the cancer might be present. According to the estimations, it's about 20% chances of mammograms missing breast cancer at the time of screening. It could be more possible in women having dense breast tissue made up of more glandular and connective tissue than fatty tissue. Also, there are cases where breast cancer develops and grows quickly in the year or so after a true negative mammogram. And then the myth 4. Consuming too much sugar causes breast cancer. The fact 4 is that there is no such evidence or conclusion that sugar in the diet causes breast cancer. Not only breast cancer, but for all types of cancer, there is a common myth that sugar can feed the cancer and speed up its growth. It's not only those cancerous cells, but also the normal functioning cells that consume sugar in the blood, that is, glucose as fuel. It can be stated true that cancerous cells consume sugar more quickly compared to normal cells, but there isn't any such evidence to state that excessive sugar consumption causes cancer. Some studies claim that diabetes is linked with a higher risk of breast cancer, but researchers aren't sure if it's due to overweight or that they have higher blood sugar levels. And now, here's the myth 5. Early stage breast cancer rarely recurs. The fact is that even with early stage breast cancer, there is always some risk the cancer will return. Many people believe that early stage breast cancer that hasn't moved beyond the breast and underarm lymph nodes has almost no chance of recurring or coming back. Although most people with early stage breast cancer won't have a recurrence, the risk never goes away completely. Even at 20 years after diagnosis, people with stage 1 low risk hormone receptor positive breast cancer have a 15 to 20% chance of recurrence. Recurrent breast cancer can be local or regional, meaning it can come back in another part of the body, such as the bone, liver, or lungs. And next is the myth 6. Breast cancer only happens to middle-aged and older women. And the fact is that younger women can get breast cancer as do men. According to several surveys, women aged between 20s to 30s also acquire breast cancer. So it's not entirely age dependent. The other fact about the breast cancer with men is that it's quite rare, but not entirely impossible. Myth 7. Breast cancer always causes a lump you can feel. Breast cancer might not cause a lump, especially when it first develops. People sometimes assume that breast cancer causes a lump that can be felt during a self-exam, using this as a reason to skip mammograms. But it doesn't always cause a lump, and by the time it does, the cancer might have moved beyond the breast into the lymph nodes. Although self-exam can be a good idea, but it isn't a substitute for screening with mammography. Some other myths about what types of breast lumps are worrisome or are less worrisome are also interpreted, such as if you can feel a lump that is smooth or moves around freely under the skin is not breast cancer. Whereas any lump or unusual mass that can be felt through the skin needs to be examined by a healthcare professional. Thus, one needs to learn the facts but avoid the self interpreted misconceptions to lead a safe, healthy, and better life. Burst those myths before it rusts your mind. Thank you.
There is a lot of information out there, and it is really important for us to get the facts right. So, thank you for that, Nabila.
Lastly, we have Rakshita and Rashmita, who will be sharing with us a very personal story of the life of a breast cancer survivor. Over to you, Rakshita.
Hello everyone, this is Rashmita, and I'm going to share a story of a breast cancer patient. It was just like any other day, going to the library, arranging, collecting, and issuing books. I was always busy with things and never cared about myself. Because why should I? All I need to do is take care of my family and go to work. Maybe I should have cared about myself. Day by day, I feel like I'm losing my sensation. Maybe I should just go to the hospital. But why bother? Nothing serious is ever going to happen to me. Or so I thought. I had to go to a doctor because I totally lost sensation in my breast. I didn't expect them to tell me I was diagnosed with stage 2 of breast cancer. Why would I? All my life, the only thing I cared about is my family. They said I would survive it if I got it operated, and that's it. We did it because I trusted them and myself that I could get through it because I was strong. Weeks went by. I thought I got rid of it. It should have. With all the treatments and never have I skipped them. But I was wrong. They suggested getting a checkup again, and I hoped it would be better now. And so I could stop my medications and treatments. But now my cancer was resurrected. I had to go to through it out again. Every pill, every session, everything, even the pain. It should have stopped, but it never did. It went on spreading to my lymph nodes. Why was this happening? I always made sure I had my pills, went for treatment, then why? Every hour feels longer with this pain. I was told that if I got operated again, it would be fine and I would survive. But I went through it again, and this time both my breasts were taken out. I will survive this, right? I'm strong, aren't I? I feel empty now. This pain is making me numb. This process doesn't really change much. Every minute seems longer with this feeling. I keep looking at myself in the mirror, but I don't recognize this woman. All I see is this weak, hideous looking person. I felt weak doing my everyday work. It's been 1 month since my operation. Then why am I not getting any better? Days went by, and it seems like my family doesn't care about me anymore. I felt like I was the cause of these fights every day. Am I that hideous that nobody seems to look at me anymore? It feels so difficult to get out of my bed. I don't know if it was because I don't feel like it or I just couldn't. All I see is darkness and feel numb. And all I could do now was sleep or wake up to take medicines and ask someone to help me out. I feel left out from my family. I feel unseen, like no one cares about me anymore. All I am now is burden to the doctors, to my family, and even to myself. Maybe I should just take a long rest. This was the story of a 35-year-old breast cancer patient who, like most of the women, couldn't make it. Receiving a diagnosis of breast cancer can be one of the most distressing events a woman can ever experience, and they might not even know where to turn for help. Distress typically continues even after the initial shock of the diagnosis has passed. As a woman begin what is often a lengthy treatment process, they might find themselves faced with new problems. They might find their personal relationships in turmoil, for instance, a feeling of tiredness all the time, worried about the symptoms, treatments, and mortality. They might also face discrimination from employers or insurance companies. Factors like these can contribute to chronic stress, anxiety, and depression.
Hello, I'm Rakshita. As my partner has shared a sad story, I'm going to share an inspiring one of a breast cancer patient. The life of a housewife surrounds around family, household chores, neighbors, relatives, etc. There is no time for self care. How can a middle class woman, housewife, ever imagine her life changing because of a disease? The word cancer can make any person freak out. She never took care of herself. How can she even imagine of having breast cancer when her life revolved around only four walls and a few people? A 45-year-old woman was being diagnosed and faced stage 3 of breast cancer in her right breast, which spread to her left breast also. She was so scared by the word cancer. There were huge lumps in both of her breasts, and bleeding took place from her nipples, which tensed her for the first time about her health. She was immediately taken to Bangalore for biopsy, and then immediate surgery was taken place and ended up removing both of her breasts. She was losing hopes. She was losing hopes in everything. People will not accept her in the society. Her family will not respect her anymore. She was losing hopes even in living her life anymore. Though it was a successful surgery, still she had to be under medication for 5 years. She was also told that serious precautions have to be taken, like no glass bangles should have to be worn on her left arm. She should not lift up any heavy materials, and her left arm should never bleed due to any cuts or any other reason. She was under medical radiation for 2 months. But with God's grace, family support, and some time given to herself, she is happily living her life, even right now. Her present age is 55 and is healthy and happy in her life with family and friends. This is a life example of hope in cancer patients. There is hope if you believe in yourself and consult a doctor if you have a doubt in any way. Try to meet a gynecologist once in a month. Awareness always helps people to live their life more, longer, and happier. Thank you.
Thank you,
Thank you,
Rakshita and
Rakshita and
Rashmita.
Rashmita. Courage does not always roar. Sometimes courage is a little voice at the end of the day that says, I will try again tomorrow. May this story give hope and strength to those in need.
Thank you, participants. With this, we come to end of our discussion. If you have any questions for the participants, please feel free to drop them in the chat box.
We'll wait for another 2 minutes to see if we have any questions.
There is a question from our mentor, Ms. Arpita Sen Gupta. She says, how long does breast cancer treatments take?
Participants, please feel free to answer the question. Rakshita would like to answer the question. Please go ahead.
First of all, it depends on the person. So, in which stage he or she is on the basis of breast cancer. Usually, people go through, if they are in first stage, the treatment takes almost 2 years. But then also, they have to be quite attentive and take precautions all the time. On the other hand, if you have crossed stage 3, you are on a very critical condition and people expect less from you and they think like you're going to die soon. So it's not like that. Depends on you how much hopes you have, how much courage you have, how much time you give to yourself to make it cure. So we can assume that it's almost 5 to 6 year treatment if you want to treat yourself completely to normal.
Thank you, Rakshita. I request the audience to please feel free to drop in any questions to any of our participants. All right, then. We hope that this discussion not only helps you become more vocal about breast cancer, but also to help and inspire those affected by breast cancer through education and support services. I'd like to conclude this discussion by thanking both our club mentors for providing us this opportunity to conduct the event. I express my heartfelt gratitude to all the board members for their immense support. Most importantly, I'd like to thank all the participants for their cooperation and for making this discussion a grand success. Last but certainly not the least, I would like to thank the audience for their time and attention. Once again, thank you, and I hope you all have a wonderful evening ahead.